Our other top story tonight, a vaccine mandate for anyone working in healthcare. But some say they're concerned this puts an extraordinary amount of pressure on an industry that's already stretched to its limits right now. News 12 New Jersey's Chris Keating is live tonight with reaction on this story. Chris?
And Brittany, under this brand new executive order coming from Governor Murphy, healthcare workers must fall in line or they'll likely lose their jobs. And there's something new under this order. Murphy says there will no longer be a test-out option. Anyone in a healthcare setting must be vaccinated and will now be required to get a COVID booster shot as part of Governor Murphy's order.
We are no longer going to look past those who continue to put their colleagues and perhaps, I think even more importantly, those who are their responsibility in danger of COVID.
That means people working in a hospital setting, a county jail or prison, or a nursing home must comply with a vaccination.
For those in our healthcare community who remain unvaccinated, you have until January 27th to get your first vaccine dose.
There's a major push for vaccination within nursing homes. Currently in New Jersey, there are outbreaks in 557 facilities. Over 12,000 staffers are ill with COVID-19. Nationwide in nursing homes, there's been a spike in cases and deaths. Yet with the help of vaccination and boosters, the rate of deaths is 10 times less compared to December of 2020. But some facilities are against the mandate, fearing a loss in staff if forced to booster. Chelsea Senior Living has facilities in 16 communities here in New Jersey. 10 to 15% of the staffers of the 1,100 employees could be affected. Their president saying this mandate placed on top of the already stressed labor market in long-term care is detrimental to our residents. While this presents a challenge with reduced staff, communities such as ours are now scrambling to provide COVID-19 vaccine and booster clinics, giving way to an already taxed healthcare environment. Meanwhile, the union representing 14,000 nurses and medical staffers at hospitals around the state say that vaccination isn't the issue for hospitals.
Staffing's the issue. Staffing was the issue before the pandemic. So at a time when workers are leaving the workforce in enormous numbers, I really don't know how this helps us at all, get staff to the bedside.
And we'll try to
As for the testing option, Murphy noted that's coming to an end anyway. President Biden, with the backing of a U.S. Supreme Court decision, passed mandatory vaccination for healthcare workers. Currently in the state of New Jersey, Governor Murphy says 48% of the population has their booster shot, a number which he says is much too low.